Okay, great. Well, good morning, everyone. It's nice to see all of you. Thank you for taking the time today to join our meeting. I sent an agenda yesterday, so I'm hoping that you received it. If you didn't, please let me know, and I'll make sure to email it to you after the meeting today. My name is Sally Bolin, and I'm going to kind of start to kick off the meeting, and we will go from there. One of the things we talked about at our last meeting, so I guess I'd like to officially call the meeting to order. I don't know if the committee would like to go around and do quick introductions, or if you feel comfortable just skipping that part, because I think a lot of us know each other, but we might not all know each other. Do we feel the need to do that? Okay. So
yeah, I think we are all good. Yep.
I think okay.
Thank you.
Thank you. Okay, good. So one of the things we talked about at our last meeting was that we would all take turns with taking notes. So I don't know if anyone would like to volunteer to be a note taker for today.
Sally, actually, I've arranged it so I can be a note taker today.
Oh, that's awesome, Jean. Thank you so much.
Something we have to share. So it's
way to go, Jean.
Yeah, it's for this one, Pete. You're next.
That was actually at the end of our agenda, as we were going to identify our meeting for next, our note taker for next one. So we're moving right along. That's awesome. So, and then we, Representative House took wonderful minutes from our last meeting. I was wondering if we'll need approval of the minutes, but also would like to see if there are any corrections, additions to the minutes.
There were two adjustments. One was my exclusion of point number 7 on the list of priorities. I was like, I thought we talked about it, but I was like, I don't think it fits. But whatever the case, we missed number 7. And okay. Then Jean talked about, I believe it was point number 24, Jean, or 23-ish.
Well, I thought you're right, Representative House. I thanked you for doing the minutes, and this. I just didn't think we were maybe science or experience was really science. I actually thought was better to look into increasing brain health. I didn't think that necessarily exercised the expertise of most of the people on the meeting.
Okay, yeah,
but that's just my personal feeling, Representative House.
I totally understand. So whatever the group decides, I think those were the two adjustments. Other than that, I think it's cool. But everyone else, please feel to chime in.
I thought we had a lot on our plate anyhow, and that brain health just felt better in that other group.
I agree with Jean. That sounds scientific to me.
Well, that shows it's not our subject area, Pete.
So, and I'm sorry, what number was that one again? That was 24?
Yes.
Okay, thank you.
You know, and if something comes up, I think along the way and we realize, gosh, you know what, maybe this is something we need to include, I'm sure we can always write it up in the report, correct? So if something comes up later on down the line, so, okay. All right. Any other discussion items, changes to the minutes?
Move approval.
Okay, thank you, Pete. And may I have a second? Thank you, Jean. All in favor?
Aye.
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 Opposed? Any abstentions? Okay. All right, minutes are passed. Thank you so much, Representative House, for taking those minutes. I know it's minutes are not always the fun thing to do, so I appreciate that very much. So I just kind of put an agenda together, but with us being a group and, you know, all of us kind of having so many skills and expertise, and I just wanted to, I don't want to be presumptuous, so if there's anything else that anyone, the group feels would like to be added to the agenda, reordered, I just kind of wanted to just go over just real quickly. I wanted to talk a little bit about the chairs for the committee, the chair position, which we'll talk about. And then I think the next step we need to do is review our committee purpose and topics and identify our next meeting date. So those were kind of the three things I was hoping we could accomplish today. I don't know if there's any other things that the group feels like we need to feel like we add to our agenda for today, or is this sufficient? Okay, we'll just move on to the next item, and if something comes up, please feel free to speak up. One of the things I approached, I just wanted to mention, and I apologize ahead of time. Last time we had our call, I was traveling with my family, and I lost connectivity multiple times, and I kind of just gave up after a while, so I apologize for that. But wanted to check in with you. I'm a little concerned with the amount of work that we need to do, and I know that all of us are juggling multiple things in our other work. And I spoke with Leanne and I spoke with Representative House, and I know both of them had volunteered to serve in some type of help out in helping facilitate this group. And I would like to propose to the group, if everyone's okay with it, and Leanne and Representative House are okay with this, because I contacted them about the three of us co-chairing the group. And a couple reasons for that is I think it'll help spread the workload. I also think that that way, if one of us misses a meeting, we can just keep moving along and not worry about waiting on my schedule or someone else's schedule. And I'm also a big believer in many hands lighten the load, and the more brains around the table, the better everything is. So if you are okay with it, I would like to propose that we have all three of us co-chair, and we can collaborate and split up the work to move forward the task force, particularly given the short time frame that we have. So I guess I just, I don't know, Leanne or Representative House, if you have anything you wanted to add, or.
I'm very willing to help in that capacity. I agree with you on all points. So I was also having connectivity issues last meeting, so I apologize for that as well. So I'm more than willing to help if the group is okay with that. I think it's going to help in many areas.
Thank you. Is that okay with everyone?
I accept on us being a throuple.
Yeah.
A throuple it is.
A triumvirate.
There you go.
Awesome. Okay,
Yeah,
great.
I'm fine. I'm fine with that. I noticed one of the other groups had done that when we were going through the reporting out last time, and I'm like, oh, maybe we should have done that. So that's good.
Awesome. Well, thank you all. Thank you very much. So great. And thank you, Leanne. And that is a huge relief for me. So, good. Okay, great. All right. So we'll go ahead and move on to item 6 on our agenda. I think the next step, and I kind of just took a stab at this. So again, it's just, we don't have to follow this this format, but I think that the next thing we need to do is kind of look at our our expectations and start to put in regards to what our group is expected to do, and then start to put some thoughts down in regards to what this all means and how we're going to approach this work. And so I attached a separate document that says, what I did is I took the summary sheet, because it was helpful for me to kind of just break it down into chunks to talk a little bit about what it is our committee is responsible for, excuse me, and then and then I started thinking about some things about, such as how do we define this, what kind of perspective do we want to approach it with. Are there items that need clarification? Is there any type of, additional framework or anything else that we feel like is important for us to use to achieve our purpose? And then I'm assuming we're also going to have to pull data and information. And so I was hoping that maybe today, and of course, welcome all your input, suggestions, we could spend a little bit of time kind of examining what our purpose is and what that means, and begin to talk about then, how we come up with recommendations, because ultimately we need to come up with some recommendations for the report. And Alex, it's my understanding that the RFP is going out soon, but it's probably going to be at least a month or so before someone's actually been contracted with to assume assisting with this. Is that correct?
With regards to the RFP, yes, it will be going out soon. With regard to the timeline thereafter, once a vendor is announced, that timeline I am not sure of. I can certainly speak with leadership to get a better appreciation for that and get back to you.
Okay, thank you. So we need to keep moving along then, is my impression. Is that correct?
Yes, that's correct.
Yeah.
We can proceed, and then once a vendor is announced and engaged, they will help us continue our efforts thereafter.
Okay, great. Thank you. Okay. So my thought was today, and I guess I'd like to hear from the group, because certainly, for every one good thought I have a day, there's about 50 behind me that weren't so good. I'd like to hear from the group in regards to, does it make sense for us to kind of, look at what our committee is charged to do? Does it make sense? Are there items that we need clarification on? What perspective do we want to use? Do we want to start narrowing some things down? I guess I'd just be interested to hear, because when I look at this, this could be defined very, very broad. When you think about Alzheimer's and dementia, you have people who, are have mild cognitive impairment all the way to end of life, and the supports and services that are, provided throughout that whole spectrum can span, 10, 15, 20 years. And the needs are very different according to where the individual is at and what kind of family of supports they have. I mean, I'm speaking to the choir, you all know this, but, and so just trying to get a better idea in regards to how we as a task force want to define this and move forward. So, yeah.
Well, I was just going to say, Sally, I looked at your piece last night, and then also previously it looked, and I sort of thought, due to the shortness of time, that maybe what we do is call on, if people feel like there's a part that they can do, they could just say that. I'm kind of collecting all the data, and I'm only really missing about 2 pieces right now of existing dementia services within assisted living, and dividing it out between a private pay model and a Medicaid funded model.
Mm-hmm.
So I've gathered a lot of that, and should within the next week to 10 days have that available to the maybe even, well, probably about a week, have that available to the committee. That's like a part I feel I can do. So maybe we see parts that that exact would be existing. And I guess I kind of thought where you say possible capacity, possible or future capacity, I mean, lots is probably possible, but what is a likely future capacity? And then I thought we needed to find out, which you may well know yourself already, Sally, with your involvement even with the Alzheimer's Association, what are the expectation, all those things relate to how many people will have those needs. And as you pointed out, even within people having those needs, there are various levels and what would be appropriate for them, from the person with mild in the community, moving to more pronounced needs, moving to very pronounced needs.
Yeah. No, I think that's a great point, Jean. Yeah. That's great. Yeah. Thank you for doing that. Any other thoughts from the committee or reactions to what Jean had to say, or what they could?
This isn't really. Sorry, I
Oh, you're
stopped on the
good,
last
Pete.
part of your words, Sally.
Nope, you're good.
This isn't so much a reaction to anything Jean said, but more just thinking about this as a whole. The work of the committee, and it feels to me a little strange because we've got this consultant who's going to be coming on, and who apparently, as my understanding at least, is going to be doing the majority of the quote, what I will call grunt work of developing the report. But they're not here yet, and so it's like, okay, what is the appropriate role of this committee in the interim? Where are we going to basically duplicate, or maybe start doing some of that detail level work? And I guess kind of like what Jean was just talking about, or is there some other way that we could better integrate what this committee does with the consultant? Because ultimately, it seems to me, once the consultant's on board, what we're going to be doing is more directing or managing the work of that consultant within the area that's been designated for us. I mean, the capacity issues, and we're going to be looking at, and so maybe what we do in the interim, this is just a thought for discussion, is see if we can expand on the words that we have on the paper, which come out of the statute, and maybe develop further direction for the consultant, so that when they come on board, they've got the direction down, and they can start moving forward. And then our ongoing role would be to review their progress and make sure that they're staying on course and that kind of thing. So I'm just thinking about it from a process standpoint. We're a little bit putting the cart before the horse. But.
Yeah, I think that's
I agree with that with Pete, and I guess the kind of the hybrid model between what your thoughts are and kind of like what the work Jean is doing. I think each of us, maybe even if we kind of like allocate, kind of, a subject area to to each of the committee members, and maybe we can, bring ideas if we have an expertise, or just kind of have it be a free for all. That way, whoever gets on will have at least a start, what I'm saying, of our ideas of where to start. That's all.
I'm fine. I mean, I just felt like I didn't want us to leave everything. Otherwise, it's going to be a really rushed section at some point. I mean, these could be, but I'm fine with just clarifying, if nothing else, say in the area. I was just trying to exercise my expertise in help of the committee.
So are you guys thinking we take these topics and just kind of start to delve into them a little deeper, to start having people that maybe have more expertise in certain areas look at these, as you go down through the numbers? Is that kind of what you're thinking? Like we just kind of...
If nothing else, they could develop the questions if they have the expertise. Like, just for instance, say with assisted living, it's very divided between a private pay model and a very small Medicaid or government funded model. It's divided between whether it's a memory care unit, whether it's a secure memory care unit, whether it's a complete building that's memory care. I mean, there are just lots of intricacies. And I guess I'm trying to think, not that, I think the consultant's probably going to be wonderful, but will they even know all the right questions to ask? So maybe it's sort of a combination of, providing stuff that then the consultant at least knows the questions they should be asking, or what it is they ought to try to be finding out.
Yeah, I think that's kind of what I was thinking, Gene, is better defining each of these points and saying, okay, here's some things that we think would lead the consultant in the right direction. And I don't have an issue or problem with if we have some of that information already, as you said, you're developing it, Gene, for assisted living. That could be replicated elsewhere. If we have it, then sure, why not provide it? It goes to it's a building block for the consultant to work with. But I kind of felt like giving them better definition of each of these items might be helpful. But anyway,
I'm fine with that. Although it's very clear to me that when you use the term, we're the capacity committee. So at the very bottom rung, in my opinion, what we're trying to do is the first item Sally put under the committee charge. We have to know what the current capacity is. We have to be able to see what the future capacity could be, the existing capacity, etc. I mean, that's really core to me as a part of what our committee is doing.
Mm-hmm.
And in multiple settings, I mean, Sally has the expertise of adult day, they're just, so I was just trying to utilize those things. Because I'm worried about suddenly we're in July
Mm-hmm.
and there's just, well, we've just been talking about how we were going to do it, but we don't have anything.
Yeah, it's a good point. Yeah. Any other thoughts from any of the group members?
This is Joe Russell. I definitely agree with what's been said. I think trying to work within the confines of what we think the consultant will do alongside not just kind of doing nothing is probably where we want to be at. Piecemealing out seems to make a lot of sense to me as well, given the timeline. And I think we just maybe need to figure out where people fit best.
Great, thank you.
Sally, I do have a question about something you did send out. I just don't understand the legend on the amended Sub-Bill 24 topics. I'm confused by all the green and red marks. And circles as opposed to, I guess that's really sort of maybe a trapezoid or something. But so what does green mean on them?
So this came from Alex, and Alex, please correct me if I'm wrong, but I think the green are the ones that were added to the various subcommittees, and the reds are the ones that were removed. Is that correct, Alex?
He may have left, Sally.
He may have left.
I'm still here. Sorry, I was on mute and talking, and no, that is correct. Yes. So the green indicates an addition, and the red indicates deletion.
Thank you.
I just thought it might be helpful to have that just to reference as we were discussing items today. So that's why I instead of sending both of them, I just sent, because there is an amended one that's cleaned up, but I just I thought it might be helpful from a recall standpoint.
Oh, I like it, Sally. I just didn't get it for sure.
Yeah. You should have I should have put a legend in there. Sorry about that. So, okay. So if I'm hearing from everyone, and that makes great sense to me, and that's actually, sounds good, is, we can start thinking about individually where potentially we might have data and information and resources that will be helpful for the group and for the task force that we can share as we continue to move along. But maybe what we need to spend some time today, and if we don't finish it today, maybe in another meeting, is really putting some further definitions to the areas that we're responsible for, as well as maybe adding some questions and some areas, just because I think that's a great point. I mean, the consultant will be hugely helpful, but they are going to need to rely on us for some of this information. Is everyone, did I summarize that okay? And are we comfortable moving forward in that path? That seems to make sense to me. Great.
Yes, I'm good.
Great.
Thank you.
I'm sorry. I don't want to cut anyone off. Did I miss? No. Okay. So it sounds like what we maybe want to do is start with the various items under Senate Bill 24 in regards to the topics. The numbered areas is, and then maybe that we can reference our charge as we need to make for clarification as time goes on. Does that seem like, do we just want to start kind of dive in and start with number one, and Jean, I can help take some notes too, just so that we capture everything. Does that, I guess from a process standpoint, does that, we can just maybe review them and then talk about them, see if anyone has any thoughts? Does that seem okay to just go ahead and move forward?
Yes, it does.
Okay,
Yeah, sure.
Awesome. Okay, great. So if we look at number one, the state's role in providing or facilitating long-term care, family caregiver support, and assistance to those with early stage or early onset Alzheimer's disease and related dementias. So
that's really a policy issue. So that I do think that, really a consultant can't come up with that. That's something we as a group need to discuss and make a recommendation on, because it's really policy.
Mm-hmm. Yeah. Any other thoughts from the group about that? Does that seem to make sense? One of the things I was thinking about is, with some of this, and maybe this is something the consultant can help with, but we could certainly check with some other resources. Is I do know that there are some other states, I just can't think off the top of my head what they've done, where they're looking at providing support and services to individuals in early stage and early onset dementia, and so there might be some things that the consultant could potentially identify to help provide some policy that could be, because like even, I'm going to show my age a little bit, but like 15, 20 years ago, people, when they were diagnosed with early onset with dementia, it was like an automatic denial from Social Security. And so there was a lot of advocacy that happened so that when you have a dementia diagnosis, you can transition onto Social Security earlier, particularly if you're in your 40s and 50s. So, there might be some things, I think, from a tax standpoint, there's just all kinds of things that could be potentially helpful for people. So I would think that, we might be able to learn from some other states or some federal legislation or some federal initiatives, that might be helpful. So in that area.
One of the issues in this area when it talks about facilitating long-term care, and then it's talking about early stage or early onset Alzheimer's disease or related dementias, and that ties in when you talk about long-term care. You start looking at level of care, and level of care requires a certain degree of impairment before it kicks in. So long-term care, as far as governmentally funded, doesn't, early stage may be too early. Now, early onset, if it may be early onset, but if it's gotten, if it's progressed far enough, even though the person's still relatively young, they might meet level of care. Then we have the Home and Community-Based Services Access Act proposed, but it does call for eventually lowering the level of care to 2 IADLs. And 2 IADLs is a very low level. And many people who are, early stage could well have IADL impairments, but not yet have ADL impairments, not yet need supervision on a 24-hour basis to avoid harm, the kinds of things that are in the existing level of care requirements. So, that's about the most, going back to Gene's comment about, staying in our lanes of what's our expertise. That's about the most I can lend to that one.
But those are really great points too, though, Pete, that you bring up, that I think, and certainly when you talk about early onset too, I think, that, sometimes people get misdiagnosed, and it's a long road for them before they figure out what's going on with them. So, and then what implications for that is, yeah. So those are really great points. So
well, and I'll just add, I'm sorry.
No, go ahead. No, it's okay. Go ahead.
I was just going to say, from my personal experience with my mother, in this, I don't know how this fits in other than early stage and even medium stage. It was very challenging to do anything that would really help her, because she didn't want it. She wanted independence. She wanted no one to be messing with her or, doing things for her. And so it's like, okay. And she ended up getting taken advantage of pretty significantly because of that. But it was like, okay, there's only so much you can do. And so I guess where I'm coming from on that is, a part of this is finding ways to, so to help the person understand what's really going on as best, is there like expertise in that could be brought to bear somehow, that, so people could take advantage of things that they really need, but maybe don't think they need.
Right.
It's kind of a rambling statement, but.
So Pete, do you feel that it's almost more the caregiver or the other person in the home that needs that knowledge and that information? That's what I've, again, personal experience with my mom, and have very good friends going through this right now, early onset, and I feel like they need that help, to know what's available and to know what's out there. I don't know. I feel like it's a different number down the way. But when they talk about long-term care, it's like you said, almost more the home and community-based services that they're almost in need of early on.
Yeah, I was focusing more on like the family caregiver support and the assistance, which are the other parts of that listing, and really it's kind of, I guess it'd be both. I mean, in my mom's case, she didn't have anyone living with her; she was living in an apartment by herself. So it was kind of more how would the family caregiver or family members be able to, what tools could they have to help the person, in my case, my mother, be comfortable with getting assistance, and accept it, because obviously we don't want to force anything on anybody, but there are needs there, and part of getting the needs met is for the person themselves to be willing to allow them to be met.
Right.
I feel that all of the first 4 items, that we would be truly benefited by some kind of a connection with the Alzheimer's Association, who might have lots of information, not just from Ohio, but from across the country, on ways to do these things.
Yeah, I mean, there's so many great resources out there, through the Alzheimer's Association. There's through the Administration for Community Living. There's the National Alzheimer's and Dementia Resource Center, which is really focused on, I mean, like Ohio has 5 or 6 grants right now, multi-year grants from ACL that are focused on, community-based initiatives and services for individuals living alone with dementia and their caregivers. And so there's a lot of really great resources out there. I think part of it is, bringing it to fruition so that it's doing exactly what Pete was talking about. What can you do, to help families who the individual doesn't want help, and, what do you do to help coach them through that process? And because it's just not a one-time pamphlet or a one-time fact sheet, there's just it's bringing it really to the community and, what is it that maybe could be intertwined through the area agencies on aging that have the caregiver support programs already to bolster what's already in place. And I think this might be helpful to turn back to ODA, because I know there's some specific plans in their state plan on action plan on aging. I think it's called their SAPA, that could maybe help tie into some of that. But yeah, I think you're all really, those are really great points. So I know one of the things I'm hearing a lot more too, and I'm not sure if this is, this again, so talking about broadening our scope, is this too much? But, I've had several employers call me because they have employees who are showing signs of dementia, and there is not a lot out there. They don't know what to do, and it gets so complicated, not only from, an employee standpoint, because you want to take care of your employees and respect them, but then at the same time, what can you legally do and not do? So, I mean, I've been getting a lot of calls about that lately. It's kind of interesting, and I think people are really struggling. So, there's just so much under this umbrella that we need to probably think about. So, I don't know if any other group members have any other thoughts or suggestions.
So if we need to pose all of these thoughts in some type of either questions or fact, we've just only started on number 1.
Yeah, I know.
We've come up with so much information. I'm wondering if should we be kind of submitting these in some type of, to get them in our minutes, just to make sure that, consultant or vendor, comes on board, we're giving them some of the things maybe that we don't know, but then at the same time, also we're finding out some of this information, as you guys have all mentioned, from some of these different organizations and resources that are out there. I don't know if that makes sense, but I feel like we'll put this in the minutes, but should there be some other, kind of sub topics there that we make sure we get addressed when we need that additional help from, basically on all of these.
There should be a working document. I agree.
Yeah. That's a great point. Yeah. Maybe what we can do from our minutes is insert these in certain areas and to move forward. So I think that'd be probably helpful for the consultant. So just from a process standpoint, because we're at 8:44 already, and I know that we're scheduled to end at 9. And I think that because we have just hit 1, does it make sense as a group if we continue just talking through this in individual meetings, or do we give homework to people? I guess I just am kind of curious, what is your appetite for what would be the best way to, because we can keep moving along. I just want to make sure that I'm respectful and using people's time as effectively as possible.
I think my suggestion would be that it might be a good idea to assign homework that we look at maybe the next few and maybe bite off several for the next meeting, say for example, and have everybody put things down that they would want to add to flesh out these items to go into that working document that we just talked about. And then either submit them in advance or at least, come prepared to kind of spit them out. But it might even be good to have them shared in advance if they have them done.
Yeah, I think that's, I was kind of thinking the same thing too, Pete. Is everyone okay with that? I'd be happy to take it because I'm pretty sure, Sarah, maybe you can confirm. I think we can put stuff on that shared drive. So I'd be happy to maybe break this apart a little bit more, and from Jean's minutes, at least start the first one and then leave it on there that we can add to it on the shared document. Or if you email them me, I'll just cut and paste them in there, whatever's easier. And then if you don't have time, you can just talk about it when we meet next. That's okay too. But I'd be happy to take a stab at that if that would be helpful. So,
do you want to define kind of, like maybe take them in chunks or take them in order? So we're going to do 1 through 4 or 2 through 4, or the next time, so that we kind of can keep it moving. Does that make sense?
I think that's a great suggestion. What does everyone else think? Is that okay?
Yep, that will work.
Okay.
Keeping it flowing.
Okay. Great. I saw a thumbs up from Pete. So just trying to look here how many we have. So looks like we have 13. I'm counting correctly. So do we want to maybe take the first 6 or the next 6? What do you all think for our next meeting?
Yeah, let's work it out and see.
That sound okay?
Sure, let's do it.
All right. So we'll try and so no one's gonna get an F if they don't do their homework ahead of time. So if you can get it done and then if you send it to me, otherwise just come prepared and we can work through it. And if something comes to mind on some of the other ones, you can always add it. We just might not get through the next 6 during our next meeting, and we can always go back to. So
excuse me, Sally.
Yeah.
You say the next 6. Are we talking up to 12, or are you just talking up to 7? Because we've only talked about number 1, even though those first 4 are really giant policy related areas that reference better to the research maybe that could be done, what aging's already done, or the consultant. I mean, in terms of having other resources to look at. I think from 5 to 12, it starts to get a little more specific maybe, and easier to gather information on.
Yeah, so do you want to go through?
I just wondered where you wanted us to go through to for the next meeting, Sally.
Yeah, so I was thinking, but again, so this is a democracy, right? So you can all say, no, we're not going to do it this way. We could look at 2, 3, 4, 5, 6, 7. I was just, that's, but I'm really, whatever makes sense. Yeah. And then
that's what I thought you were saying, the first group of what we had. So if we could just make sure we identify what those numbers are so we could all be on the same page.
Yeah. So if we could look at number 2, number 3, 4, and then number 5, number 7 and number 8. So it's right.
2, 3, 4.
We go through 8, really.
We go through 8. Yeah. 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 Okay. All right. I'm sure this will evolve. So as we work through it some more. So, okay. So we have about 10 minutes left in our agenda. Is there anything else that struck people with number one, maybe just to finish out that conversation, or anything else you'd like to add? Okay. Okay. And then, oh, sorry. No, go ahead,
Sally. I had to get off mute there. You know, and just in looking at all the words, I think we ought to in some way focus on the first three words, the state's role, because this question is really about what should the state be doing, and then it defines about what. So I think we have to look at different things that are kind of within the state's toolkit. Obviously, you know, funding, regulation, disseminating best practices, disseminating, you know, information, providing, I guess you could say, educational opportunities. I mean, they can do webinars, they can do things. I mean, we kind of have to define what things the state has at its disposal to do,
right,
that then could be turned to these specific topics. So I think that would be part of that whole, you know, fully dealing with number one.
Yeah. That's a great point, Pete. Jean, did you get all that?
Well, I have to say I'm cheating. I brought a staff member in this morning, and we had coffee together, and she's taking the notes, so that, because I find it distracting to take notes if I'm trying to comment and talk, but I wanted to take my turn early and get it over. Kind of like you, Representative House.
Yeah, but she did it herself, Jean. So this doesn't even count. You get to do it next week.
No. So honest on my part. It shows you how transparent I am.
That is true. That is true.
I'm going to take a note from Jean the next time. Next time, Caitlin will take the notes.
I mean, I'm sure we'll review them together, but it is distracting if you're trying to think and take the notes too.
That's awesome. Well, is there any clarification? And I'm sorry, I didn't catch the name of your coworker, your staff member, that she needs any clarification on.
Kim, did you need clarification on anything? I don't think so. She said she's good. Oh my God, what a good staff member.
That's awesome. Well, thank you so much for doing that for us. So okay. Any other comments, thoughts, or because I think that's a great point you brought up, Pete, in regards to, you know, because we do have to focus on the state role. So with number one, just because we do have to find a meeting date and identify our next note taker. So I might transition from our next agenda item if that's okay, but I don't want to rush anyone. Good. Okay. Okay. All right. So we need to find another meeting date. And we have to give a report at our next task force meeting. I don't know if this will all work with your schedule, but it seems like if we could get at least another meeting in or two to get through some of this before the end of April. I cringe a little bit because I know you're all so busy, but is that realistic? Is that possible?
Just depends.
When is our next group big task force meeting?
I believe it's the 26th.
Yes. It's always the last Monday of the month.
Last Monday of the month. Oh,
yes,
dear,
it is the 26th.
What time of day is that, Alex?
It's 10 to 10. Yeah, 10 to 12, Pete.
Okay, I better get that on the calendar now.
I guess I don't know how this 8 o'clock time works for everyone. And will I dread this for saying this? But either the 22nd or the 23rd, that Thursday or Friday. I don't know, but just putting that out there at 8 o'clock. I don't know.
We've got an eight standing eight on Thursdays. I know I'm speaking for Jane, and I don't know if there's anybody here from Leading Age, but our groups have a meeting with the Medical Directors Association every Thursday at 8.
What
Could
about
do 9,
Friday?
I suppose. But.
I will actually be out of town next Friday, but does the 21st on Wednesday, is that a bad day for people, or?
Yeah, I
That'd be
can't do
better
the
for me.
21st.
Oh.
I can't do the 21st at 8.
All right, what about next Tuesday?
I could do it on the 20th. Is that the 20th? Yeah.
The 20th works for me.
20th worked for me too.
Yeah, it
Yeah,
works.
it's
The
doable
20th
for
it
me.
is.
Okay, the 20th.
Me also.
All right. That was hard.
Yeah. Does that work for everyone? I'm sorry, I thought I heard someone, but
Yes, that works.
great. Okay. And how about anyone want to volunteer ahead of time for a note taker? Or Pete, did we already tap you for next week?
Jane did. I'm not sure. Well, since she has she has Kim there with her, maybe that was a we. But, I can do notes, sure.
Thank you very much.
You could also reach out to a staff member, Pete, because I know how much you like to comment.
Yeah, I was just thinking about our board meetings and how much fun that is, because we have a 27-person board, and how much fun that is to take the notes and also try to lead the discussion.
Yeah.
All right. All right.
Anything I say is kind of a blank.
All right. Well, I think then, is there anything else that we want to bring to the good of the order? Otherwise, I think we could probably finish out our meeting. Are you comfortable all with this process? And then either Leanne or myself or Representative House will go ahead and get out the agenda in the minutes, and I'll work on that, putting together some type of document. Just, this is a silly question, but do you prefer Word or spreadsheets for either of these?